Yes, I am Dr. Taher Mahmud. I'm a consultant rheumatologist. I have a medical uh, general physician background, and I am a consultant at the London Osteoporosis Clinic, and we have a particular focus on arthritis, particularly osteoporosis. Yes, I think it was a little bit by chance. When I was a medical student, I got a chance to do an immunology project, and subsequently, I was able to do projects which were to do with rheumatology as a clinician, and also research. In fact, there was a time when I was thinking about doing gastroenterology, but I was very privileged to spend some time in rheumatology. Going, the thing that was a turning point is 1993. Some friends of mine went to the American College of Rheumatology meeting in the US, and we came across all these biologics, so we could reverse we could reverse inflammatory arthritis, and have lots of TNFs and a whole bunch of different things. So it's such a privilege to be working in a specialty where we can make diagnosis in a very detailed and careful and an early stage, have very effective treatments, and get people to be symptom free, and then some patients to be symptom free and drug free and out of the clinic from the medical sort of setting. And so it's an amazing specialty to be involved in, and it seems like I had an interest throughout my career, but it's a little bit by chance. This idea that we can make diagnosis at an early stage, and we can help patients. We have this mantra: our minimum standard is to help people be symptom free, drug free, and doctor free, and we can achieve that with every patient that we see to different degrees. So yeah, it's a real privilege to be able to see patients and to uh, look at them in a lot of detail, understand the sort of issues and challenges they have, and then to work towards removing and eliminating their vulnerabilities and producing a whole bunch of capabilities in them. So we take people from symptoms and disease and disability and help them be healthy and able to go ahead and fulfill their dreams and aspirations. Uh, Me of them, I look at each patient as a coach. We published a book, and I was talking about this today. I had a meeting, we were just going through some things that I've been doing over the years. Uh, and so I look at each patient as my coach. They're sort of teaching me stuff. It's all about trust and engaging their confidence, and to really understand and appreciate where they're coming from. And then we can plan the treatment to fit in their exact thinking. Otherwise, patients don't necessarily follow the advice that they're given in clinic. You may know there are WHO figures that only half of the time patients given any particular treatment or advice do they make any use of it. So I look at that and say that's my problem. And I've been involved in patient feedback for many, many decades. So I appreciate the chance to spend time with patients. They help me be my purpose. And what they appreciate about me is that I have very high standards about the outcomes for them. I have a particular way of looking at things. We have very aspirational goals, and we have a system and a process to very carefully track their progress and help them achieve those ends. So this idea of being symptom free, drug free, and doctor free, we look to achieve that as immediately as we can. And so the idea is that we really want patients who um, uh, have a hope for transformational care. So if they just want a standard thing, they want this from that, please go to somebody else. If you want transformational care, you come to us and we'll guide you and we'll get you to a place you can't get on your own or with any other service. So our thing is about holistic. It's all inclusive. We come from a place of abundance. We give you a whole stack of resources, education, classes, like a whole thing. Uh, and it's about sort of trying to get this situation where they have all this all the details and the dangers that they're in are defined, and we have a plan to eradicate each of their issues, help them be symptom free, be drug free, and eventually doctor free. That's our aspiration. Now we can get to some of that situation very quickly. Others take time. Others We have different pathways that we're to follow to correct things and so on. But that's the sort of the trajectory that we want to deliver for them, and that's the standard we hold ourselves to. So if we don't achieve those things, we sack ourselves from the case. This is our minimum standard. We don't negotiate our standard.